Hello and welcome to this Tubules clinical series. In these videos we are going to show you how clinical procedures are done and going to be talking to specialists and experts who have carried out these procedures. Today I have Dr. Paul Baker from Perio London who carried out a perioplastic procedure which we are going to show you behind us and going to talk about it. Hope it's a great educational experience for you on Tubules. Paul, welcome to this series.
Thank you, Drew. This is a case that we did especially for the filming. It's a young chap who's got some gingival recession associated with the lower front teeth. As you can see from the picture behind us, he's got a very thin tissue type. There's some localised gingival recession. I have to say I always struggle a little bit with the indications for intervention. It's difficult to know if this is a real risk to the patient's health in the longer term. And often with these procedures or these cases, I will sit back and monitor for a period to see whether or not we're getting progression. In this particular case, he's in his early 20s, he's got the thin tissue type, and he's a dentist. So I felt that he was fully informed, and the decision to proceed was a fair one. So what we're going to do is look at how we approach this as a tunnel procedure with a connective tissue graft. And as we go through it, we'll discuss a few of the other options and the other techniques that we could have applied.
Oh, thanks, Paul. Actually, indications is a good one to work about, isn't it? Because a lot of times we tend to find that it's either the patient wish, and many times I have found with the lack of keratinized tissue or minimal keratinized tissue, they can't practice good oral hygiene in that area. And I guess in this case, there's more a patient wish that we were looking at as well.
I think so. I mean, it isn't an aesthetic concern with the patient, clearly, and you can see they're doing a fairly decent job looking after it. There isn't much inflammation, but it is awkward for the patient to get to, and as I said, as a dentist, he's fully informed and feels that surgical intervention and correction is justified in the longer term, given that he's got a long time ahead of him.
I think that makes a sensible choice for us to proceed and see what happens with the procedure. And now you want to have Dr. Paul Baker talking about the case. So Paul, we're looking at the case now.